Which of the following is a function of the kidney? A. Production of erythropoietin. B. Elimination of metabolic waste. C. Regulation of systemic pH. D. All of these are functions of the kidney. The answer is D. All of these are functions of the kidney. The kidneys serve a wide variety of functions. They eliminate waste, including nitrogenous wastes such as urea and ammonium. They regulate systemic pH via resorption of bicarbonate from urine and excretion of hydrogen ions, and regulate blood pressure via the renin-angiotensin system, also known as the RAAS. In addition, the interstitial cells of the kidney are responsible for production of erythropoietin, the hormone that stimulates production of red blood cells. The internal anal sphincter is dash, while the external anal sphincter is dash. A. Voluntary. Voluntary. B. Involuntary. Voluntary. C. Involuntary. Involuntary. D. Voluntary. Involuntary. The answer is B. Involuntary. Voluntary. The internal anal sphincter is a ring of involuntary smooth muscle that spends the majority of its time in a state of perpetual contraction. It relaxes only when the rectal ampulla is distended. Passage of stool is then controlled by the voluntary constriction of the external anal sphincter. What is the most common cause of anovulatory infertility? A. Polycystic ovarian syndrome, PCOS. B. Stress. C. Poor nutrition. D. Hypogonadism. The answer is A. Polycystic ovarian syndrome, PCOS. In polycystic ovarian syndrome, PCOS, luteinizing hormone, LH, levels are elevated, while follicle-stimulating hormone, FSH, levels are often low. Because FSH aromatizes androgens to estrogen, low FSH will cause androgens to increase. Low levels of FSH and high androgens keep the follicle from maturing and prevent ovulation. Hypogonadism is significantly more rare, and while extreme stress and poor nutrition may inhibit ovulation, in the United States PCOS is the leading cause of anovulation, failure to release an ovule from the ovary. Which of the following hormones is a precursor for both estrogen and testosterone? A. dehydroepiandrosterone, DHEA. B. Aldosterone. C. Dihydrotestosterone. D. Estrone. The answer is A. Dehydroepiandrosterone, DHEA. DHEA, an endogenous steroid hormone that is a precursor for both estrogen and testosterone, is synthesized from pregnenolone in the gonads, the adrenal glands, and the brain. What is the most abundant circulating steroid hormone in humans? A. Aldosterone. B. Dehydroepiandrosterone, DHEA. C. Pregnenolone. D. Cortisol. The answer is B. Dehydroepiandrosterone, DHEA. The most abundant circulating steroid hormone in the human body is dehydroepiandrosterone, DHEA. DHEA is a precursor to several important sex hormones including testosterone and estrogen. It also functions as a neuroactive steroid. Which of the following hormones is secreted by the corpus luteum in order to prepare the endometrium for implantation of a fertilized ovum? A. Estrogen. B. Luteinizing hormone. C. Pregnenolone. D. Progesterone. The answer is D. Progesterone. The hormone that is secreted by the corpus luteum in order to prepare the endometrium for implantation of a fertilized ovum is progesterone. Progesterone prevents the constriction of blood vessels to the endometrium, which in turn prevents the shedding of the endometrial lining, menses. It also alters the endometrium, converting it to its secretory phase in preparation for implantation. Which of the following is a normal value of follicle-stimulating hormone, FSH, for a menstruating adult female? A. 16.5 mAu per milliliter. B. 120.0 mAu per milliliter. C. 25.8 mAu per milliliter. D. 4.6 mAu per milliliter. The answer is A. 16.5 mAu per milliliter. Normal FSH values for a menstruating adult female are 4.7 to 21.5 mAu per milliliter. A FSH of 0 to 4 mAu per milliliter would be considered normal in a premenarchal female, while normal FSH after menopause can range from 25.8 to 134.8 mAu per milliliter. What is the function of follicle-stimulating hormone in a menstruating woman? A. It stimulates follicles of the uterus in preparation for implantation. B. It stimulates the maturation of follicles in the ovary. C. It stimulates the formation of the corpus luteum. D. It triggers the rupture and release of the mature egg from the follicle. The answer is B. It stimulates the maturation of follicles in the ovary. In a menstruating woman, follicle-stimulating hormone stimulates the maturation of follicles in the ovary. Rupture of the mature follicle and formation of the corpus luteum are both stimulated by luteinizing hormone, LH. The uterus itself does not contain follicles. Which of the following is a normal follicle-stimulating hormone, FSH, level in an adult male? A. 23.4 mA per milliliter. B. 0.6 mA per milliliter. C. 18.8 mA per milliliter. D. 5.0 mA per milliliter. The answer is D. 5.0 mA per milliliter. In an adult male, normal FSH can range from 1.5 to 12.4 mA per milliliter. It may be slightly lower in children. Follicle-stimulating hormone is released from the anterior pituitary gland. Its target is the testes. Which of the following is a function of follicle-stimulating hormone, FSH, in an adult male? A. It stimulates primary spermatocytes to undergo meiosis. B. It triggers the initiation of spermatogenesis. C. It stimulates the Sertoli cells of the testes to produce androgen-binding protein. D. All of these. The answer is D. All of these. In a healthy adult male, follicle-stimulating hormone stimulates the Sertoli cells of the testes to produce androgen-binding protein, it stimulates primary spermatocytes to undergo meiosis, and triggers the initiation of spermatogenesis.